When people ask me what I do, I say I'm a doctor. And then they ask me what kind, and I say emergency medicine. And usually the next thing people ask for are stories with blood and guts. But the stories that I really want to share are far more tragic. One of my patients, Karen, was a young woman who was abused as a teenager. She suffered from depression and self-medicated with alcohol and opioids. At first, she took prescription opioids, but as her tolerance grew, so did the cost of getting high. Eventually, she migrated from the white pills of Percocet to the white powder of heroin. She sold her body in order to pay for her addiction, and often came to the ER after being beaten by a client. I personally took care of her twice in the ER, and I know others who cared for her as well. Karen was sad and hopeless, and had tried to commit suicide multiple times. As I cared for her, I became so frustrated that we were failing her, both as her doctors and also as a healthcare system. I did the best I could. I showed her empathy. I consulted our social worker. I had our psychiatrist see her. But deep down, I knew that just wasn't enough. I knew each time she was discharged home from the emergency department, she would be back as a victim of assault, as a suicide attempt, or maybe as an accidental overdose. And though I don't know what ultimately happened to Karen, I've seen enough patients like her to know that the outcome can't have been good. Working in the emergency room, I've seen patients suffering from heart attacks, children who were struck by cars and died, women miscarrying much desired pregnancies, and patients far younger than me who were diagnosed with advanced cancers. I've seen a lot of sadness that most people will never see in their lives. Most of these tragedies are complicated social issues and began long before the issue that brings the patients to the ER. The emergency department is often the last stop. We are the safety net for the larger healthcare system. And I believe our current healthcare system is killing us. We as a system need to do more. We need to deliver patient-centered care. And we need to build a framework in order to create a system that actually heals. For so many patients like Karen, their care in the ER points to the most significant unspoken limitation in our current healthcare system, which is that it's not set up to take care of the patient as a whole. ERs are often expected to assume more responsibility for a patient's overall health than we are equipped to do. While we can provide intervention and short-term treatment, most of the patients who come to the ER don't have access to timely follow-up care or robust social support. There is a significant lack of access to care for patients in our current healthcare system, regardless of insurance status. Approximately 1 in 8 visits to US ERs involves mental and substance use disorders. We know that in our society, these disorders are often stigmatized, which can prevent proper care and treatment. There are over 2.5 million visits to ERs each year for violence-related injury. That's almost 7,000 patients a day. And there's over $740 billion that are spent each year on substance abuse costs related to crime, lost work productivity, and healthcare. There's no emergency department that can provide the type of patient-centered care that a patient like Karen really needs. We are not set up to care for the underlying issues that coexist with mental illness, substance abuse, or interpersonal violence. We see the same problems over and over as patients get worse and our system goes broke. This isn't good for anybody. It's not good for the patients who want to get better. It's not good for the emergency physicians who want to deliver excellent care. It's not good for whoever's paying the bill. And we know that even for so-called uncompensated care, someone is paying to keep the lights on. And it's not good for our country that loses the benefits and contributions of citizens who want to be healthy. It's not good for anyone, and right now, there's no clear way out of it. Personally, this makes me really angry. I want to tell you about another one of my patients. Stephen was a 19-year-old black male who was brought in from the back of a police car after being shot multiple times in his chest and abdomen. Despite being dark-skinned, he was white as a ghost. He had lost a lot of blood and was in shock. Almost immediately after his arrival in the ER, Stephen's heart stopped beating. As doctors, we did what we're trained to do. We gave him blood. We cracked his chest open. We used every tool in our toolbox to save him. The bright red blood poured out of Stephen's body. And despite our best efforts, he died. In that moment, when we pronounced him dead, the controlled chaos of the emergency department came to a halt. The loud, bustling room turned eerily quiet. That moment, the transition from working so hard to save a life to the stillness of pronouncing death, is one of the hardest moments for me as a physician. And then, Stephen's mother arrived. The sound of her screams echoing through the department still sends shivers down my spine. Stephen's death was a tragedy, not only because he was a victim of gun violence, but because that was not Stephen's first time being shot. He had come to our emergency room a year earlier after being shot in his lower leg, but it was only a flesh wound. He had no broken bones, he didn't need surgery, and so he wasn't admitted to the hospital. We just treated him and sent him home. And we know how that ended. I've cared for so many Stephens, young men who were shot but only had flesh wounds. I've sent them home from the ER just as my colleagues have. That night when Stephen died, I thought, wait, how many other Stephens have there been? How many young men have I sent home just to return and die? Am I just wasting my time? Are ERs just revolving doors with no end in sight? Could that second shooting have been prevented? And the thing is, we did the best we could. The ER didn't fail him. Our society did. This is a failure of our social system. I believe it doesn't have to happen this way. I believe working as a healthcare system, we can do more for our society. When patients present to us with mental health illness, addiction, or interpersonal violence, they don't just need medical help. They need patient-centered care. What would that healthcare system look like? What would that society look like? It would look like a place where the larger healthcare system is more effectively addressing patient needs, where patients have timely access to care, where mental health illnesses are not stigmatized, where we treat addiction with innovation and compassion, like running supervised injection sites for heroin users, like Karen. Where gun violence is recognized as a public health issue. Where we fund violence research and treat its victims without judgment or bias. And where our communities come together in order to develop and implement solutions. These things are not impossible. Other countries have accomplished them, and we can do it too. It's about getting everyone to recognize a few basic truths. That everyone is entitled to care. Everyone deserves a chance, whatever their socioeconomic status. That we treat individuals as part of a larger whole. That we can't afford to throw people away or to act like their problems don't affect us. And that patient-centered care can work if we're willing to prioritize life. Don't you think we could have done better for Karen and Stephen? Maybe Stephen could have seen a social worker after that first visit. They would have spoken to him, maybe asked him about his life, and maybe his mother wouldn't have had to scream like that. As an ER doctor, I say to all the Karens, to all the Stephens, and to all the Stephens' mothers, we will always be here for you. As a human being, and as a mother myself, I say to all of you, take care of yourselves, and please, take care of each other. Thank you.